All right, so today we're really going to get into these new weight loss drugs, the ones everyone's talking
Yeah.
about. We've got this Washington Post article. It came out pretty recently, September 24th, 2024.
Yeah.
And it's fascinating. It really digs into what's actually going on beyond all the hype.
Yeah, it's like we're going behind the scenes a little.
Exactly. Like, is it really a miracle cure?
Right, because that's what we keep hearing, right? It's like
Yeah.
everyone's saying miracle this and miracle that.
Right. And this article kind of shows us.
Yeah, it's a lot more complicated than that.
Yeah, it's way more complicated for both the people taking these drugs and the doctors prescribing them. It's
Yeah.
not as simple as like just take this pill and boom.
Right, there's so much more to it.
Yeah, so the article starts with the story about a woman named Maze Wable, and it's really something. Okay. So she loses over 30 pounds on Wegovy, which is one of the drugs, and she feels amazing, like she's on top of the world, and then all of
Yeah.
a sudden her pharmacy is like, "Nope, we're out. We don't have any."
Oh, wow.
Can you imagine?
That's awful. Just trying to get your medication and it's just not there.
Yeah, and it's not just like a one-time thing. She spent months, like months, trying to find more Wegovy.
I bet that's what the article was saying, right? These shortages are a huge problem.
Huge for all of these drugs that mention Ozempic and Mounjaro. They're all facing these shortages.
Makes sense though, right?
Yeah.
I mean, the demand is just so high.
Oh, for sure.
But still, you need your medication. You need your medication.
Exactly. And even if you can find it, the article talks about how expensive it is.
Oh, yeah, I was reading that part.
We're talking over $1,000 a month for some of these if you don't have insurance to cover it.
Yeah, and not everyone does have insurance that'll cover it.
Exactly. It's a huge barrier.
Definitely raises some questions about who gets access to these medications.
It does.
Like, is it only going to be people who can afford it?
Right. And that's not really fair.
Not at all. That's what I'm saying. It's
Yeah.
an equity issue.
Yeah, huge equity issue. And on top of all of that, there's another thing that I thought was really interesting.
Okay, what's that?
So, a lot of these drugs were first made for people with diabetes.
Right, right. I had heard that.
But now, with all this focus on weight loss, it's like,
It's like a whole different ball game now.
yeah, are the companies making them even making sure the people with diabetes can get them?
Right. Are they even prioritizing them anymore?
Exactly. And they talked about that in the article, even mentioned a Senate hearing about it.
Oh, wow, really? See, that's what I mean. It's like this whole other issue.
It is. And Senator Bernie Sanders, he was talking about how expensive Ozempic is here in the U.S.
Yeah, it's crazy expensive.
$969 a month here?
I know, it's crazy.
But you know what it costs in Canada?
What's it cost up there?
$155.
Get out. No way.
I know. And in Germany, it's only $59.
You're kidding.
Nope. Makes you wonder what's going on there, right?
No kidding. Something doesn't add up.
Right. So we've got shortages, we've got this cost barrier.
Right, and those are just the beginning.
They're just the tip of the iceberg. And you know what else? The article, they call these forever drugs.
Because you have to keep taking them, I guess.
Exactly. But then it also talks about how a lot of people are stopping after a few months.
Really? That is interesting.
It is. So that made me wonder, is it even realistic?
To expect people to stay on them forever.
Yeah, I mean, forever's a long time.
It is, and who knows what the long-term effects could even be.
Exactly. I gotta say, this whole forever drug thing, it kind of makes me nervous.
Yeah, I get that.
It just seems like, I don't know, something you'd really want to think about before just like doing.
For sure, and it's not like there's tons of research on what happens if you take these drugs long-term.
That's what I'm saying.
Yeah.
What does the article say about the risks?
Well, it talks about how these medications actually change how your body works.
Really?
Yeah, like they're messing with your appetite, your metabolism, all that stuff.
Ah.
So it's not like you can just stop taking them all of a sudden.
That makes sense. So I guess that's why they're talking about these drug holidays, to kind of ease into it.
Maybe. But like we said, there's not a lot of research on those either.
Right, right. So what are doctors saying about people staying on these medications long term?
It's all over the place.
Yeah.
Honestly, some doctors are saying, stay on them. It's like having high blood pressure. You wouldn't tell someone to stop taking their blood pressure medication after a year.
Right, because then it just comes back.
Exactly.
That makes sense. But the article also said that a lot of people don't stay on the medications.
Yeah, a lot of people stop.
Why is that? Is it the cost?
That's probably part of it, for sure.
Yeah, because it's not cheap.
And then there's the shortages, too.
Oh, right. If you can't even get the medication.
Exactly.
Yeah.
But there's another thing, I think. I think some people just aren't mentally prepared for what it means to be on a medication like this long term.
It's a big commitment.
It is. It's not like, taking a Tylenol for a headache.
It's like changing your whole life.
Yeah. And the article, it even mentions that some people find that whole forever drug thing really overwhelming.
I bet I can see that.
So it's really important to talk to your doctor, be honest about your concerns, and make sure you're ready for that kind of change.
It's like a whole other thing to think about.
Exactly. It's not just about the weight loss. It's about everything else that comes with it.
So it sounds like we need a lot more research on these medications.
We do, unlike everything.
Like what happens when you stop taking them, how to figure out the right dose, all of it.
Yep, all of that, especially because people are doing all sorts of stuff with these medications.
Because of the shortages and everything.
Yeah, and just because they're trying to figure out what works best for them.
It's like we're still at the very beginning of understanding how to use these medications.
Oh, we are totally at the beginning.
That's kind of exciting.
It is, but also kind of scary, right?
Yeah, because we don't have all the answers yet.
Exactly. There's still a lot we need to figure out.
Speaking of things we need to figure out, the article mentions side effects too.
Oh, yeah, that's a big one.
Yeah, what's the deal with that?
So basically, because these drugs are so new and people are using them in all these different ways, we don't have a good handle on the long-term side effects yet.
Oh, I see, because everyone's kind of making it up as they go along.
Yeah, like people are changing their doses, switching between medications. Some are even getting off them entirely because of side effects or because they hit a plateau.
That's a lot.
It is. It's a lot to keep track of.
No kidding. The article called it a Wild West situation, and I'm starting to see why.
Yeah, it totally is. We have these potentially amazing drugs, but we're still trying to figure out how to use them safely and effectively.
It's a lot to take in, right? Like, where do we even go from here?
It really is. I mean, on the one hand, you have these drugs that could really change things for people.
For sure, they seem super promising.
They do. But on the other hand,
We've got a lot to figure out still.
you do. We need more research, more information.
And in the meantime,
People need to be careful.
exactly. That's what I was thinking. This article did a good job of, like,
Of laying it all out there.
yeah, like all the stuff we need to think about.
For sure. It's like a wake-up call, in a way,
Totally. So, for someone listening who's maybe thinking about trying one of these medications, what's the main thing they should take away from all of this?
I think you got to go into it knowing it's not a quick fix.
Right. It's not just going to be like, take this pill and all your problems are solved.
Right, exactly. And talk to your doctor.
Oh, for sure. Like, really talk to them.
Really talk to them. Be honest about your expectations, what you're hoping for, your concerns, all of it.
And do your research too, right?
Yes, absolutely. Be informed, know the risks, know the potential benefits. It's your health.
It's your body. You get to decide.
Exactly. And like we said, what works for one person might not work for another. Everyone's different.
And that's okay.
It is okay. The important thing is finding what works for you.
With your doctor's help.
Yes, always with your doctor's guidance.
This has been, wow, it's really made me think.
It's a lot to process.
It is. Weight loss is so much more complicated than
Most people realize
than I
that.
even realized. And we just scratched the surface here.
We did. We really did. There's so much more to it.
So if you're listening and you want to learn more, go check out this article. We'll link it in the show notes.
Yeah, it's definitely worth a read.
It'll make you think. It'll make you ask questions.
And that's what we want, right?
Exactly. Keep learning, keep asking those questions, and we'll be back next time with another deep dive.